Good afternoon, everyone. I'm presenting the outcome of integrated campaign of measles, polio, vitamin A, and deworming integrated campaign conducted in Somalia in Banadir region. I'm Dr. Farid, medical officer currently working with WHO Somalia. Just to give you a brief background information about Somalia. Administratively, Somalia is divided into 7 states. It's Puntland, Galmudug, Hirshabelle, Southwest, Jubaland, Somaliland, and Banadir administration. So each of these states have their own authority, governed by their own elected government, and have their own ministries of health. So we can say there are 7 ministries in Somalia. Banadir is an administrative region, Banadir, and it is a capital of Somalia. It is also known as Mogadishu. Mogadishu is hosting around 2.7 million population, and it has 17 districts. An integrated campaign was implemented in November in 2019 in all southern states except Banadir. Southern states are 5, excluding Somaliland and Puntland. The rest they call southern states. So in the rest of the states, campaign was conducted in 2019 November, and in Banadir there was some delay because of different reasons. And in March 2020, after reporting first case of COVID-19 in Somalia, all campaigns were postponed, including response to CVDPVs of polio and also of this integrated campaign. Talking about measles in Somalia, it is endemic in Somalia. Every year, cases are reported, like 23,000 cases were reported in 2017, and then more than 9,000 cases were reported in 2018. In 19, there were 4,514 cases. In 2020, until week 40, the cases were 1,949. Half of the cases were reported from Banadir, and 80% cases are below 5 years of age. Currently, like in 2020, there are also VDPVs, vaccine-derived poliovirus, or also isolated from environmental sampling sites, and also from AFP cases. So this is the situation of measles and VDPVs in the country of Somalia. The objective of campaign, integrated campaign, was to immunize at least 95% children aged 6 months to 59 months with measles vaccine. It is an additional dose irrespective of previous immunization or disease status. The other objective is to immunize at least 95% children with, from birth to 59 months under 5 years with polio vaccine. The polio vaccine which was used in campaign was BOPV. And then also to supplement all children aged 6 months to 59 months with 1 dose of vitamin A according to the age of child. And also children from 1 year above also received deworming tablets, albendazole, up to 5 years. The integrated measles, polio, vitamin A, and deworming campaign in Banadir has conducted by Somali authorities, health authorities, with technical support from WHO, UNICEF, and other global polio eradication initiative partners, and national and international partners, including Gavi, the Vaccine Alliance. So it was a joint supported campaign by different partners and donors. So the team composition and service package. For the service package, it is, I mentioned earlier, additional dose of measles vaccine, 2 drops of BOPV, vitamin A, and deworming tablets. The team composition was of 7 members, including 2 vaccinators, 1 data recorder, 1 social mobilizer, 1 person for vitamin A and deworming tablets, and 2% for administration of BOPV. In this campaign, more than 3,000 health workers were deployed at fixed and outreach sites. In addition to 7-member team, there were community-based rapid response teams deployed for COVID-19 surveillance. Were also part of, but also supported this campaign by visiting house to house and mobilizing parents to bring their children to fixed and outreach sites. In addition to this operational human resource, like involved in operations, the social mobilization component was also there. Megaphone were used and the social mobilization activities were also carried out. So to mobilize parents. For advocacy, the mayor of Benadir was also involved. Ministers, deputy minister of other line departments were also involved in inauguration, and also religious leaders were there with community leaders. In Benadir, there are also population of IDPs, internal displaced population. So that was also part of the micro plans, and teams were deployed to vaccinate IDPs population as well. So targets. 4,442,000 children from 6 months to 5 years were for measles vaccine. 492,000 children were under 5 years. And for deworming, the target was 393,000. So the target for vitamin A was also of measles, 442,000. Antigen and the other package was deworming tablets, vitamin A, BOPV, and measles vaccine. Campaign was implemented from 30th August to 3rd September 2020, and in all 17 districts of Benadir, including IDP's population. So the results. For the measles and vitamin A, 92% children vaccinated against the target, which is, it is an administrative data. And for polio, 93% children vaccinated received BOPV, and 92% children got deworming tablets. There were some challenges, and we also learned so many things from this campaign, like for supervision. During this COVID-19 pandemic, especially, we ensure that vaccinators, community, and supervisor follow COVID-19 SOPs. So for that, number of supervisors from MOH, Ministry of Health, UNICEF, and WHO was increased to ensure that vaccinators followed and implemented the COVID-19 SOPs and the required infection prevention control. The SOPs were jointly developed by MOH, WHO, and UNICEF. Training session, because in training, like 3,000 healthcare workers were deployed. So for the training, there was a challenge how to manage, because previously we were bringing in a session around 30 persons. But now to observe COVID-19 SOPs and social distancing, we reduced number of participants and increased number of sessions. So by doing that, we were able to train all the vaccinators and supervisors. Distribution, collection of vaccines and other logistics. Team members coming for collection of vaccine and logistics were asked to come at least at the gap of 10 minutes from each other. So it is in the morning and also in the evening. They were coming at the gap of 10 minutes to not to make a huge uh, not to make a problem for a distributor, and also during the data sharing and other thing and other supplies. So for crowd control, community volunteers played an important role in crowd control and ensuring social distancing. Daily meeting, only supervisors were called for a meeting because to avoid any gathering. So only supervisors were called for an evening meeting. For PPEs, masks, sanitizers, gloves were distributed to vaccinators and also their supervisor. And that was enough for vaccinator and supervisor. So we learned that integrated campaign is cost effective compared to single antigen intervention. Community also benefited from integrated campaign and welcome integrated package of services, because previously only OPV or measles vaccine were provided during campaigns. So this time the parents were getting vaccines, vitamin A, deworming, and also BOPV at the same point. Campaign activity were conducted in 17 districts of Venezuela, including IDP's camp. Looking at results of this campaign, in future, integrated campaigns will be conducted where possible. Like we learned a lot, and it is a cost-effective and efficient way to conduct a campaign. So these are some of the pictures from the campaign. Despite of different challenges, the vaccinators are taking vaccine and other logistics. Even in floods, there are far-flung areas in the lower right picture. This is an IDP camp. Children are playing. So these are some of the pictures from the campaign. So thank you. In Somali, they call it Maat Sanid.